Okay, so let's see how to approach these breaking bad news stations, and I'm going to speak in details, and no one from now on or going on should have a problem with it because I discussed it before twice. Today, I'm going to go into more details, and I'm going to also show some presentations I made for you guys to just help you to cover these bad news stations, and it shouldn't be a problem for you anymore, inshallah. So, as our general frame, which we spoke about it, you have to introduce yourself to the patients, confirm the patient identity, confirm the agenda of the meeting and taking permissions, ask how much do you know about their condition or about their relatives' condition, about your father's condition, about your husband's conditions, whatever, and ask them about their expectations, which is extremely important. And we have to break the news gradually, which is extremely important point. And if you didn't do that, they will fail you the stations. I know native English doctors, like he failed the whole exam just because he didn't break the news gradually, he told me. And the examiner commented like this: he makes him fail the communication skills at the stations, and he said you didn't break the news gradually, you straight away told the patient about the bad news, which is something to put in your mind. It's really extremely important to break the news gradually. I will show you in my presentation shortly, like how to approach that. And you have to show sympathy and empathy throughout, and to explain to them the disease, its complications, and the most important thing, to explain the management plans, including referring them to multidisciplinary teams, and discuss about palliative care if needed, and or end of life care, depends on the case. And in the social history, you have to touch on the with whom you are living, and if you like you need any support at home or not, and what do you do for livings, and how your symptoms affected your job and day-to-day activity. And we need, the most important thing, to ask about the concern, and even we don't ask once, we have to ask more than one times, because there will be more than one concern. And we should offer follow-up and support, and website, leaflet, brochure, and our department numbers. I went fast on it because I did it, I said it many times, I recorded in previous recordings, but this is the steps we should follow to be organized and to make the station easy for us. We should never mess these steps around, and it's very easy to remember, and should follow it in all the communication skills to be organized, and examiner will be able to follow you as well. But in terms of how to approach breaking bad news and breaking bad news, it sounds easy, but unfortunately, like honestly, people fail it a lot easily. Like the you can fail breaking bad news very easily, and let's just minimize this. So you can fail this station easily for many reasons. The first reason for failing this station, the fact that it's very common station. The examiner know that you expecting these stations, you already prepared for it. So the standard is in this station is high, because it's extremely common station in the exams. And the second thing makes you fail it, because even when they compare you with other doctors, it's gonna be also hard, because anyone knows breaking bad news stations, and anyone come to the exam fully prepared for this station. So the standard of marking will be even high. And the third thing, uh, due to time management, especially in the Irish exams, is difficult for you, I can see from your performance today, to break the news gradually, or even to give the patient time to absorb the information, and see the reflections, and acknowledge their feeling, which is mandatory. But unfortunately, I don't know how this could be managed in the Irish exams, but try your best. It's better to break the news gradually, and omit some social questions, rather than give the patient the news all at once. Um, So let's give you like all I know about Breaking Bad news and what you need to have to do this station perfectly well to get really high marks on it. First, just we need to know what is bad news in the first place. So bad news, it's any information which adversely and seriously affect an individual view of his or her futures. And that's why it difference, and there's another point I'm putting, who is the recipient, because even like it will be different from one person to another how to perceive this news. For example, just to tell the patient you have diabetes or have high blood pressure, for some patient is so what, is nothing. For some, so for other patients it will be like, oh my God, I'm going to take this tablet for the rest of my life. I'm going to go to the clinic for regular follow-up for the rest of my life. And I'm going to have my son amputated because they have experience in their family, someone who had his legs or his foot amputated. So it's really, it will be different from some person to another how they perceive this news as bad, and even like how bad it is for them. So, and this is, we should know our patient. We should know what type of patient it is. And maybe in the exam setting will be hard, but also I'm not only teaching you for the exam, for even in the real life, you will know your patients and you will know them because they will be with you in the ward for a few days, and you really know them, uh, and you will know their background, if they have psychological background or mental background, and if they're ready to receive the news or not. So this is really important um, consideration to put in our mind even before breaking any bad news. And it's really important, if you want to tell someone bad news, you need to be ready about all the information around it, like what's the disease, what complication it has, what treatment available, what support available. Otherwise, don't break it. Let someone else to break it for you, because it will be disaster if told someone you're having this disease and you know nothing about it, or you're having this whatever conditions, and you don't, or even your father has bleeding in his brain, but you don't know, is this bleeding is going to be managed surgically or is not. You don't know anything about it. So it's really important to know before you approach your patients how you're going to manage them, even about the prognosis, how bad the outcome will be, are they going to survive, uh, whatever. So you need to be prepared, and there are many different stations coming in the exams. So you need to know the outcome. For example, one last time we spoke about meningitis. The candidate who did it, she couldn't answer the surrogate about the meningitis prognosis, like complications. Like, is his father going to develop, or him? I don't know if it was the patient. So, is it going to develop these complications or not, or how much the percentage? So it's really important to know in the for the exams, like what the outcome and what is the prognosis. Because if you ask these kind of questions at these levels of seniority, you doing basis exam, you should have like the basic informations. So key skills to make you really good in your breaking bad news. The first thing's ability to elicit the patient main problems, their perception of these problems, and their emotional, social, physical impact on the patient and their family. So ability to elicit the patient main problems. So sometimes, they bring, like for example in Block 2, my case, his father had intracranial hemorrhage, and he wasn't concerned at all. He doesn't care. Like, even maybe he has a problem with his father. Like, he doesn't like his father. I don't know, but his reaction is absolutely ridiculous. He like what we like whatever. Like, he really, it didn't influence him the news. So you need to know what your main problem. Now I'm telling you the bad news, but I need to know what is your main concern. He will tell you, my main concern is like how my father's going, where my father going to be treated. He doesn't want to be with him at home. He wants him to be treated in the hospital or at hospice because it's too much for him to take. He's busy with his work. So this kind of things we need to when we approach the station, we need to ask the patient, we need to know their main concern and which is the area is the area of the major marking. And if you fail concern, you will fail the whole station no matter how good you are. So please ask the patient, what is your main concern? And again, ask again before the station, ask, may I know what is your biggest worry? Is there anything else you want to add for me? Is there anything else you want me to help you with? So always make sure you cover all patient concern, because sometimes, especially in the basis exam, they can have four concern, hidden agenda, lots of things inside. It's not written outside in the task, but you need to find out yourself. And many people they say, I failed the station despite I did it very well. The examiner unfair. No, not the examiner not fair, but you didn't find anything from that patient. You just came with certain frame, certain script about the station you learned about previously, and you thought it's going to be the same stations. You approach it in the same way, and you missed lots of things which were all hidden agenda in the patient head, but you didn't make any effort to get it out of those patients. You didn't ask for it. The patient will never, the surrogate will never volunteer for you any information unless you ask. They are instructed by this. So, and ability to check the patient understanding. So if you, an ability to tailor various information to the patient needs. So not every patient needs you to tell them about everything. That's why you need to ask them, how much do you know? Do you want me to tell you? Some patients, they don't want to know details. They need just only they need to know how you're going to manage them and what the prognosis. But I don't care about the physiology of the disease. I don't care how it happened. I don't care what symptoms is causing me, because I'm gonna discover it myself. Don't stress me out before it happens. You're telling me complication, they might not happen. So you need to know how much information they need to know. And you need to check their understanding and ability to elicit and explore the patient reaction to the information. It's really important. As I mentioned in my case, the patient wasn't concerned about, and it wasn't bad news for him. His father has bleeding. Uh, Maybe now he's thinking about how he's going to hire whatever his father has. So people are different. Don't think everyone loves his father. Don't think everyone he's gonna die after his father death. So people will react differently to the information you're giving. So you need to check how they reacted and acknowledge those reactions. And if you find them silent, I say you can ask directly. May I know what's going on in your head right now? If there is anything I can help you with, but you have to find out exactly the reaction to the informations, and this will help you like even what more information to give them. And ability to determine how much the patient wants to participate in decision making, as I said, how information they want. Ability to discuss treatment options so that the patient they can understand the implications. Ability to enable the patient to follow agreed decision about treatments. Always don't tell the patient we're going to give you this, take it or leave it. No, you will tell them, is it okay by you? Like if you even if in the long consultation stations, when you speak about management, ask them, is it okay by you? And if you have option, tell them the option. But if there is no options, there is certain treatment, tell them, ask them, I'm going to refer you to this group of specialties, is it okay by you? It's extremely important. They're not going to give you the mark of clinical, even clinical communication in all the stations, in the short, in the long, there is part to check your skills in clinical communications. So if you want full mark in that, you have to take permissions. You have to make them agree on the management plan. You can't force it on them. Ability to identify, offer, and discuss and signpost relevant further support, as I mentioned. So psycho, as I mentioned before the recording, so psycho-oncology counseling, information resource, brochure, leaflets, and sometimes support group. All of you know about spikes, which like is how to approach the breaking bad news. We use this spike approach, and I'm going to speak about it now. And I know that you know it, but to help you, I put you the sentences you need to use in this spike protocol. So now, even you have the language, so please read it, take a screenshot, whatever, learn it by heart, own it, make it your own. language. And if you do another practice, please show me you learned from that. So spikes. So S S stand for setting. In the setting, first you need to do your best to minimize any distractions and interruptions. Um, Close the phone and private room, blah, blah, blah. Prepare yourself, make sure you are up to date of the patient information. As I said, always you need to be ready before you approach the patient. You have all the information you need to convey to them, and be ready to address any concern that may arise from the patient or their family. For example, prognosis, management, and its effects, as I mentioned before. And perceptions, you need to ask the patients or their family how much do you understand about the condition, like as we did in our approach, like we ask them how much do you know, and we ask them, for example, um, why did you do this test? So you tell you the patient has did blood test and CT reveal that he has this disease. So I will ask them, may I know how much do you know about your father condition? Can you tell me what symptom did he have before doing his scan, or if I'm talking about his father? And was there anything that you thought it might be causing his symptoms? And this is very important. Like now, when you ask, was there anything that you thought it might be causing his symptoms? Now you're starting to break the bad news gradually. This is the first sentence. Uh, like was there anything that you thought might be causing your symptoms or his symptoms, if we're talking about relatives? So this, now he will tell you, could it be cancer, uh, or I tell you I don't know, he will give you simple disease. So now you know that he's not ready for the news at all. He's optimistic about his disease. But if he told you, could it be a cancer, I will ask him again, may I know why you think it's a cancer? And I'm still being preparing him for receiving the bad news. Invitations, ask a patient or their family how much details or information they would like to know. As I mentioned before, knowledge, break the bad news and check understanding. Break the news gradually and give them time to absorb the information. I already spoke about that earlier, but it's really important points. I would emphasize on it, to break the news gradually and give them time to absorb information. So I'm giving examples. I don't have the result here. Sorry, I do have the result here with me today. Would you like me to explain it to you right now? So we asking permissions about, would you like me to explain it to you, as you can see, and would you prefer a family member or friend to be present with you? And even this sentence by itself, it's showing the patient that I'm going to give you bad news. That's why I want someone to be I'm asking you if you want someone to be present to support you. Even I will complete the sentence. Would you prefer a family member or friend to be present to support you? So now I'm still breaking the news gradually. I'm telling them you need support for the news I'm giving you. As you know, we took a biopsy. Now I'll start to tell the news. As you know, we took a biopsy, and unfortunately, the results are not as we hoped. So I'm still breaking gradually. You could see how many steps until I tell the patient you have cancers. I ask about expectations. I ask about what do you think, if you think anything could be causing your symptoms. I ask them if you want anyone to be present to support them. And then I said the result is not as we hoped. So all this, I'm still preparing them mentally that I'm telling you bad news. Can you see like how we breaking the news gradually? Is it doesn't come in one sentence or two sentences as well. So I will again say I'm afraid, and every time you speak, you pause, you stop talking for a few seconds and check the patient reactions and acknowledge their reactions. This is how should be made. And then I I would continue saying I'm afraid it's a tumor. It's still, even I didn't say cancer, just tumor. It could be benign, it could be malignant. And the last step, now I'm going to speak about the bad news. Now, yes, I reach, after all these sentences, I reach the point that I'm going to tell the bad news. I'm deeply sorry to inform you that the test result came back positive for a serious disease, or unfortunately, the biopsy result indicates that the tumor is malignant. And I pause and I see his reactions and I acknowledge his reactions and offer support and reassurance at the same times. Even if the advanced disease, reassurance could be just as like we're going to make your father as comfortable as possible. Like reassurance could be in many ways can be done even if it's advanced disease. So now I reach the management plan. So I said the cancer physicians assess your father, and he believes that your father condition is very advanced. Even after saying is cancer, now we said very advanced. Can you see like how we gradually going through these informations? So the cancer physician assess your father and believes that your father's condition is very advanced, and you have to stop as well. And unfortunately, he's not fit for chemotherapy or radiations, and only for supportive care. This decision was taken in the best interest of your father's condition, and as he is not going to have any benefits at all from such therapies, and he may suffer from the side effects of this treatment. Embassy acknowledged the feeling that caused by the news. I can see this news was a huge shock. Can you tell me what is your biggest worry? Can you see now I'm asking about the concern, I'm asking about the biggest worries because this is one of the major marking area. I can see this news was a huge shock. Can you tell me what is your biggest worries? I can see that this is a lot to take in. Please take your time. There is no rush at all. I can understand that this information will cause a lot of queries on your mind. Please don't hesitate to ask me any questions. I'm here for you. I can see how this is difficult for you, and I understand how you must be feeling. Is there anything else to whom you would like me to talk? Is there anyone else to whom you would like me to talk to? Even if he refused to have a family member to be present, now you told him the news, you can ask him again if he needs someone, like to call someone for him to come and support him now, because now he is devastated by the news. And the last thing, summary, repeat the main points of the discussions and plan forward. Arrange time for further questions. Examples. So, what we are going to do is to refer your father to a multidisciplinary teams from a tumor physicians, a Macmillan nurse, a psychiatrist, a social worker, and pain management doctor to give your father the full care and proper plan of management. I'm going to give you some leaflets about advanced cancer bowel and palliative care to be more aware about it. I'm going to give you the contact number of our department to contact us at any time if you have any other query. Now we are done. It's just some legal issue for the Irish people, or even for the basis, just to remember the legal issues about these stations. May I ask if your father has any advance directive, living will, or power of attorney? DNR, do not resuscitate attempt, is a decision of the treating teams. The patient has the right to ask for do not attempt resuscitations if he is competent. The patient or any of his relatives does not have the right to ask for resuscitations. The patient has the right to refuse any treatment if he's competent. Any questions, guys?
Yes دكتورة. in this case يعني ما هسأله إنه do you want anyone to attend this meeting with us مش لأنه I'm talking to the son.
No. So always we ask these questions, and they have the right to say yes or no. So if the patient, if we're talking to the son, okay, and we're telling him about his father, so the son could have other family member siblings. So he could have even like the next of kin. It's been could be just nominated by the family, or even the father chose him to be next of kin. But now we're talking about someone who has advanced disease. The rest of his siblings, or the rest of his sons and daughters, need to know about his deterioration for sure. So normally the next of kin is obliged to update everyone else, but he may need his family to be present, and even like friends is absolutely fine. There is no breaking of confidentiality right now because the patient is dying, and the thing that he will decide. We are not forcing him. We will asking him. We ask him, and he can decide. Uh, Especially after telling the news, now he knows the news and he can decide to share it with someone else or not to support him, not like to break the confidentiality of his father. But the point is not about the question. Like you can ask me the same question if I ask him like this. Some people say like this: if I ask him early on before the breaking bad news, and he didn't know, if you ask him if you want someone to be present, and you told the news after that, he may be upset because he wasn't expecting it. But that's why when I ask if you want someone to be present to support you, I ask it at the point that I'm telling the patient, unfortunately, the result of the biopsy, for example, is not as we hope. And at this point, I will ask, do you want someone to be present? Because now I showed him it's not as we hope. What's going to be cancer? Okay, he already will be mentally prepared to receive bad news. So at this point, I will ask him if he wants someone to be present. So it's again, it's his choice to say yes or no. There is no breaking confidentiality here. It's his choice and no problem at all. So you can ask these questions. No issue with it.
Okay, another question please. I should ask about the advanced directive والحاجات دي مش
Yeah, so if the stations like advance, the patient condition is advanced, so now we know that most likely he will be not mentally competent, and this is where the advanced directing living will and power of attorney should come when the disease is advanced. But if the patient, for example, the station is just, I told you, he's for palliative care, but it's still like he has COPD, he may live like 1 year. If you omit it, it's not going to be like fatal. But if the patient condition is advanced, you have to ask this question. You must ask these questions, and they help you in planning further management plan. Because if he has, for example, both attorney, they can refuse. They can make decision on behalf of them, and can they refuse type of treatment and this kind of things. I think the time is running out, unfortunately. Any other questions?
Dr. Alfar, can we use the word tumor? It is not medical term, so it's
No,
normal to mention that it's tumor.
in the UK, it's not a medical terms, but I don't know. In the Arab countries, they're very strict about jargons. So if you need to say anything else, lump or whatever, so
Yes.
say,
Or lump.
yeah, lump, overgrowth.
Overgrowth. Thank you so much.
nasty growth يقولوا.
Okay.
طيب معلش آخر سؤال يا دكتور عفاف.
Yes, please, as far as
الستيرويد he asked me about steroid. Is it part of the palliative care or no?
yes, this is very, very good point. So palliative care, we discussed it before. That's why I didn't speak today about it. So palliative care it doesn't mean it's stopping any active treatment, including steroid, any management he taking. It just means symptomatic treatments. But if they said end of life care, it means to have to stop any treatment apart from the palliative care treatment, which is the symptomatic treatment. So if the case is just said about palliative care, you will not stop any active treatment, including the treatment he's using for his chronic disease, anything. But if the case is about end of life care, you stop any treatment and it's going to be only symptomatic treatment.
Okay. Thank you.
You're welcome.
Thank you.
Any other questions? There is some question asked in the WhatsApp group yesterday. I think it's about the social life. If we're talking to the son, do we need to ask him about the social life of his father? Yes. We ask about with whom your father is living and if he needs any support financially or he needs someone to support him at home. But we don't ask personal question. We don't ask about smoking or alcohol, but we ask about if his father needs any support financially or needs someone to look after him at home. This is absolutely fine to ask. All right, thank you everyone. See you in another session.